Well, I'm joined now by Ahmed, who's a consultant bariatric surgeon and an expert in gastric bands. Good evening to you, Mr. Ahmed. What do you make of the report's findings about the effectiveness of gastric surgery?
Good evening. It reinforces information that we've known for at least the last 10 years, but it's very nice to see the study because it actually homes in the message in a UK-based population. But we've known for many years now that bariatric surgery, weight loss surgery, is highly effective in not just helping people lose weight, but also in helping cure some of the 12 serious ill health problems that patients get from their excess weight.
So we're talking there about blood pressure, diabetes and heart attacks. What about the cost, though? Because it's what, £9,000 for surgery per patient?
It is, but if you take that into context, so for example, in the UK, the cost of treating diabetes for a patient is roughly £3,000 per year. So you can see that diabetes is a chronic disease, so that's £3,000 per year every year for the rest of their lives. So in 3 years, and the surgery itself will cure the diabetes in about 2 years. And the cost of treating diabetes will take, forever, basically, whereas the surgery cost is £9,000. So you can see that there's a massive cost saving. And that's actually not even including the other health benefits that come along, because a lot of these patients will have diabetes, but also they may well have high blood pressure. They may also develop arthritis in their joints from their excess weight. So you get a massive improvement in all these health problems. And that's why, it is such a cost-saving exercise for the NHS. And I'm not even including the fact that these patients, a lot of them can't go to work, but once they lose weight, they're actually back at work and they're, basically, providing more to society and paying taxes, etc. So there is a lot of cost-benefit from that aspect as well.
What do you say to those who would argue that it's up to individuals to take responsibility for their weight? It's not up to the NHS to intervene with surgery?
Yes, I think the issue here is that obesity has been stigmatized as, a disease, or actually not as a disease, but actually as a consequence of greed or of lifestyle. But actually, when a person becomes obese, they reach a certain weight where their metabolic function is permanently, changed. And we know that it is a disease and it needs to be treated, with the correct treatment. You wouldn't, if somebody had an accident from skiing or, develops lung cancer from smoking, you wouldn't deny them, treatment. So similarly, obesity should be regarded as a disease for which there is treatment available, which is highly effective and very safe.
1.4 million people, though, believed to be morbidly obese in the UK. Do we not need to be taking a more serious look at the causes of this? Absolutely, but the problem is that a lot of the attempts at curbing the rising tide in obesity haven't really worked. Every year, the obesity incidence is increasing. Yes, absolutely, we should work at teaching children to eat healthy, do more exercise. Because it's a big problem in children, a growing problem in
absolutely.
Children,
but the problem is that there is, in our modern lives, we have a lot of access to high-calorie but very good tasting food, which is easy to prepare. And we have availability of modern transportation techniques, which means we don't actually have to leave even our homes to do work. So the combination of cheap, unhealthy food together with a more sedentary lifestyle is, in my opinion, one of the reasons why we're seeing this rising tide in obesity.
So who at the moment is eligible for weight loss surgery on the NHS,
right.
And how would you like to see it change?
Actually, I think in our country we have excellent guidance. We receive guidance by NICE, which is a body of the NHS, National Institute for Clinical Excellence. And according to NICE, anybody who has a body mass index, so that's your a ratio of your weight in kilograms divided by your height in meters squared. So if your body mass index is 35 and you have an obesity disease such as high blood pressure or cholesterol, you would be eligible for surgery. If you have a BMI of 40, without any of the health problems, you would also be eligible for surgery. And what's really interesting is that just last year, NICE changed the entry criteria for patients with diabetes. So for diabetics, if your BMI is 30 and over, you're actually eligible to go to your GP and request a referral to a specialist hospital for bariatric surgery.
Okay, Mr. Ahmed, thank you very much indeed for joining us.
My pleasure, thank you.